Again, thank you very much for coming back and visiting our channel once again. In fact, I'm very, very happy to see you here once again. Yes. So as I've informed you earlier on today, we are going to do videos on all the medical conditions in medical nursing 2, starting from today. Yes. So in case you're not aware, in medical nursing 2, we are going to talk about the disorders in 2 major systems of the body, which is the cardiovascular system and then the respiratory system. Yes. So we are going to shoot all the videos on all the medical conditions in this particular system that I've mentioned, which is the cardiovascular system and then the respiratory system. Yes. So I'll be very, very glad for you to stay with us right from the beginning of everything that we are doing. If you find out that it's educative, you leave a comment, you share the videos, and then like it. Just share the videos to people you think they need this. Yes, educate the people out there using this video. So before I delve into our topic of discussion for today, let me just make these clarifications here. So when we're about to do medical nursing 2, you'll be doing other courses before you delve into the disorders. Yes. So let's take the cardiovascular disorders for instance. In case you want to start the cardiovascular disorders, there are some other courses you have to do. Maybe you do the anatomy of the heart, you do the assessment of the heart, you do common symptoms of the heart. Yes. So like all those things needs to be done before we delve into the disorders. But then you know that this channel, like what we always do is that we educate our subscribers on disorders and medical conditions. So I am not going to tag that. I'm jumping straight to the disorders. So in case you start medical nursing 2 and maybe you didn't start with the disorders, don't think maybe I've given you wrong information. But then I am much concerned about the disorders and then the medical conditions. Yes. So today let's see what we have. Real quick, today our topic of discussion is going to be on the medical disorders of the cardiovascular system. Yes, specifically coronary atherosclerosis. Yes, atherosclerosis is what we are going to discuss about today, or is what we are going to talk about today. Yes. So before we delve into our topic of discussion for today, let me quickly inform you about our upcoming series. Yes, Entwine Heart. Yes, it's going to be on a different channel, not Scholar Media House. It's going to be on Scholar Themes. It's also a different channel. Yes, as you are seeing on your screen, yes, Scholar Themes on YouTube. As we talk now, I think about 30 people have already subscribed, although the date for this actual series is going to be on the 7th of March. Yes, next month 7th. Yes, but we are taking our time to gather things. Yes, so the title for this series is Entwine Heart. Yes, it's a love story which later on developed into hatred, developed into rivalry, denial, and a whole lot. Like, the story is interesting, so please watch out for that series. Yes, Entwine Heart. Yes, on Scholar Themes, not Scholar Media House. So you can actually go and search Scholar Themes on YouTube and subscribe and wait. Yes. So in today's video, we're going to talk about everything in atherosclerosis. Yes, talk about what atherosclerosis means, the clinical manifestations, the diagnosis, the preventions, the pathophysiology, and everything. Yes, it's going to be as if you're in a class. So before we start, get a pen and paper and write something down. Yes. So real quick, let's talk about the definition of atherosclerosis. Yes, what at all is atherosclerosis? In atherosclerosis, there are two different ways here. You will see atherosclerosis with H, and then you will see one without an H. Yes. So the one with an H simply means that the hardening and narrowing of the arteries. Yes. So atherosclerosis without the H is the hardening and narrowing of the arteries, and atherosclerosis with the H is this deposition or accumulation of fat or lipid substances and fibro tissues in the arteries. Yes. So the difference here is that the one without the H is what? Narrowing and hardening of the arteries, and the one with the H is what? Accumulation of lipid or fat substances in the what? Artery. So basically, there is what the definition. There is, if you are asked to define atherosclerosis, the first thing I think you need to do is that I have to check whether this particular one is with an H or this particular one is not. There is no H in it, then you know what to tell the examiner. So for the sake of those of us who want to be jotting some things down, that is why I project this thing on your screen. Yes, so just as you are seeing on your screen, atherosclerosis without the H is the narrowing and hardening of the arteries, and then atherosclerosis with the H is an abnormal accumulation of lipid, fatty substances, and fibrous tissues in the lining of the arterial blood vessel walls. Yes, so that is what I've just said earlier on before the projection. Yes, So let's take our time to throw more light to this definition or elaborate this definition. So these substances block and narrow the coronary vessels in a way that reduces the blood flow to the myocardium. So what they're trying to actually tell you is that when there is accumulation of fat, when there is a narrowing and hardening of the artery, the rate at which blood will flow to the myocardium. We know that the myocardium is the muscle surrounding the walls of the heart. So if there is an accumulation of fat, if there is a blockage in the fat in the arteries, if there is a hardening, or if the arteries become hardened and narrowed, the rate at which blood will flow from other parts of the body to the myocardium, which is the muscle of the heart, will be reduced. Yes, so they are just trying to tell you what will happen if in case you are diagnosed of atherosclerosis. So just as you are seeing on your screen, let's continue to elaborate or throw more light to the definition here. So let's continue from repetitious inflammatory response to injury of the arterial wall or the arterial, alteration in the structural and biochemical properties of the arterial walls leads to what we call atherosclerosis. Yes. So what they are trying to tell us is that when the arteries keeps on responding to inflammatory process, when there are alterations and biochemical properties or biochemical processes going on within the arteries, it consequently lead to you getting atherosclerosis. Yes. So I can't talk about the other ones, but I think I have a little bit knowledge on the inflammation aspect. I think you and I know how inflammatory processes goes on. So in case you have a wound on your body, and then later on after inflammations and everything, just take a picture, just look at how after the wound has been healed, you see that when it leaves a scar, mostly these scars are very, very hard, more than the normal skin. So just picture it in a way that this wound happened or occurred in the arteries, and later on inflammation took place, and then the place got healed. Definitely that's how the arteries is going to look like. Definitely that place will be hardened, and that hardening, if it continues severely, you are at the risk of getting what we call atherosclerosis. So that is what they are trying to tell us. That was the definition and explanation of the atherosclerosis. Yes. So now you know the definition of the atherosclerosis for the two words, the one with the H, the one without the H, and we've taken our time to explain everything behind that definition and all that. So real quick, let's talk about the clinical manifestations of coronary atherosclerosis. Yes. So the clinical manifestation depends on three different things. Yes. So these different things are location and degree of narrowing of the arterial lumen. Yes. So where is this narrowing and hardening happening in the arteries? That is what, like, talking about the location, like where is this narrowing and what hardening happening in the arteries? Yes. And the degree, is it narrowed and hardened in a way that the space in the arteries is that small or tiny or still large? Yes, that is about the degree. And then thrombus formation, you all know that thrombosis simply means that a clot or a blood clot in a blood vessel. Yes. So if there is a clot of blood in a blood vessel, we term it as what? Thrombosis. So is there any thrombus formation as a result of this coronary atherosclerosis? And then the last one is what? Obstruction of blood flow to the myocardium. Is there any obstruction of blood flow to the myocardium as a result of the atherosclerosis? So if all these factors come into play, then there is what we are going to experience. There is what you'll be seeing with the patient having that atherosclerosis. So when all these factors come into play, we are going to have an impediment to blood flow, and it will be usually progressive, and then finally it will be inadequate. So from the beginning, the impediment to the blood flow will be progressive, like it will be as if like everything is normal, but along the line, once in a while, it will it will be inadequate. Along the line it will be adequate, then you now progress to the inadequate blood supply to the myocardium, and then the cardiac muscles and all that, which is specifically myocardium. And when there is an inadequate blood supply to the when there is an inadequate blood supply to the cardiac cells, that is why we term it as what? Ischemia, myocardial ischemia. Yes. So that is what you are going to that patient to be demonstrating And then the other one will be angina pectoris or angina pectoris. So the angina pectoris simply means that there will be chest pain related to myocardial ischemia, most common presentations. So like definitely if there are like inadequate blood supply to the cardiac cells or the cardiac muscles, then it will proceed to what we call the myocardial, like that term is what we call the myocardial ischemia. There is an inadequate blood supply to the cardiac cells, and when that happens, it will now proceed to what we call angina pectoris. The angina pectoris is what the chest pain, and the chest pain is related to the inadequate blood supply to the cardiac muscles, specifically the myocardium. Yes, so that is what the patient to showing. And most if there is myocardial ischemia, we are at the risk of what having irreversible damage and death of myocardial cells. We are at the risk of having irreversible damage and death of the myocardial cells, and this is as a result of a decrease in blood supply. If it is great enough, or if it is of long duration, then definitely the myocardial cells will definitely die off, because they lack blood supply, they will lack nutrient, they will lack oxygen and all that. And if they lack those things for a longer period of time, definitely they will die off. Yes, so there will be irreversible damage and death of the myocardial cells, and this happens as a result of decrease in what blood supply, which is great enough for a long period of time. And if it happens, definitely they are going to die off. So the myocardium undergoes what degeneration, and then they will be replaced by scars, tissues, yes, and then there will be what myocardial dysfunction, low cardiac output, and so on and so forth. So definitely, if this happens, then it means that the myocardium have to undergo degeneration. Like it has to be what it will all be what the cells over there will die off and now be replaced by what scars, and definitely the myocardium will not function properly. That's why there will be myocardial dysfunction. And then if the myocardium is dysfunctional, you know that the cardium it helps in the heartbeat, like pumping of the blood. So if the myocardium is dysfunctional, then definitely there will be low cardiac output. Yes, the heart won't be able to pump blood as at its normal range. So the sinoarterial node and all those stuff will come down. The rhythm of the heartbeat will also there will be difference in the rhythm of the heartbeat. Yes, so that is what they are trying to tell. Other clinical manifestations may also include shortness of breath. Yes, that's what we call dyspnea, especially among older patients with so that is what they are trying to tell us. Yes, so if somebody is having atherosclerosis, the other clinical manifestation to watch out for is shortness in breath, especially in older patients. And then there will be a typical symptom, which is weakness and nausea. The person will feel like vomiting, the person will feel like will be weak. Yes, so some patients may be asymptomatic, like they will not show any symptom. Yes, some they will not show any symptom. Asymptomatic simply means they will not be what symptoms, like the person will not show any symptom. The person will be there, but then there are some like you have to definitely, there are, like I'm sure the rate at which or like the percentage of people that will be showing symptoms will be high. So if like this person is not showing symptoms, it means that it will be beyond the analysis. I think doctors have to set in to do other examinations to clear or to diagnose and know what is wrong with the person. So that real quick, let's talk about people who stand the higher risk of getting atherosclerosis. So that especially the modifiable risk factors. This is where I think is much important to me. But the non-modifiable structure, like risk factors, no matter how it is, like one way or the other, you can't do anything about it. So I'm much concerned about the modifiable risk factors. So looking at the modifiable risk factors, we have what hyperlipidemia, elevated level of lipid, like elevated level of fatty acid deposited in you, elevated level of lipid depositions in you. So if you are the type that normally take things that that this thing that I'm eating will deposit a lot of fats in me, will deposit a lot of lipids in me, stop, because you are consequently exposing yourself to getting what atherosclerosis, which is not a good disorder. And then cigarette smoking or tobacco use. So those of us who like cigarette smoking, it's not only cigarette smoking, the other one, yes, you know what I'm talking about. I'm posting this video on YouTube, so I can't mention it here. But the other one too is any smoking is smoking. And then hypertension, people who are hypertensive, like people who with high blood pressure, yes, so they also stand a higher risk of getting what we call atherosclerosis. And then diabetic patients, obesity. So if you are obese, like if you are obese to the extent that like if you know you are obese, there is a need for you've gained a lot of weight, then there will be the need that you start exercising the body, start doing intensive exercise just to burn the fats in you, because if you allow this fat to be deposited in you, you stand a higher risk of getting this atherosclerosis. I hope you are getting it here. So other factors include physical inactiveness. There are some people, they don't even remember the last time they've done exercise, or they've made their body to sweat, or like did something, at least like they put themselves in this kind of exercise, running and all those things. They don't do it. So physical inactiveness or inactivity. We have metabolic syndromes, a lot. There are a lot of them, just as you are seeing on your screen, a lot of them. So that's it. So real quick, let's talk about the preventions. How do we prevent ourselves from atherosclerosis? Yes. So just as I was saying, you have to reduce or control the cholesterol abnormalities. Like you have to know how, like if you know that what I'm eating would deposit a lot of fat in you, then don't go for it. So controlling cholesterol abnormalities, and then periodic monitoring of what blood cholesterol levels, dietary changes. There are some things you have to avoid in your diet, like therapeutic lifestyle changes, diets, and all those stuff, just as we're just seeing on the screen. Yes, if you do all these things, I'm sure you'll be able to prevent yourself from getting atherosclerosis. Yes. So here comes to an end of our lesson on atherosclerosis. Yes, so I'm sure you've learned something out of this video. Yes, so if you know that you've learned something out of this video, please just like the video. Yes, click the like button and like the video. Yes, so you like the video, you leave a comment below telling us what you've been able to learn, or anything you feel like telling us under the comment section. Then try and then comment there. If you're not subscribed to, please try as much as possible, hit the subscription button and subscribe to the channel for us. Yes. Thank you very much for staying with us right from the beginning of the video to the end. See you in our next video, which is going to be on either angina pectoris or pneumonia. On this topic, one of them definitely we're going to that is going to be our next video, either pneumonia or angina pectoris. So watch us for a new video and see you in our next video. Bye bye.